I have to explain a little bit about this presentation because osteoporosis is a very complex condition and a very complex um, piece of medical situation that's being researched constantly. It's rather a new addition to medical conditions. Um, it- there, it's a lot to it, but for the first presentation I'd like to give you, I like it to be simple and I like it to be an overview of a lot of levels of osteoporosis treatment and prevention. When there are additional information pieces to pass on to you, I send them to Anda and she sends it to you via a blog or we put them in the newsletter. So there's many other parts of osteoporosis that they're researching. So I just keep that out of the water right now and keep it as simple as can be. And at the end, we'll have a little time for some questions, but I'd like to keep it to an hour. So if you could definitely keep your questions, and if there's no chance at the end, please email me. All right. So we're on page one, and this is on the left, you'll see a group of very happy women with good posture standing around our table. This is our feast table called Calcium Cafe. We have everything from healthy smoothies to terrific salads and main courses and a beautiful floral arrangement in the center. This is a calcium cafe, for people in the program if they could get to Baker Avenue. And we will have another one as soon as I can come back to the office. To the right, there's a photograph of a very active group of women doing the various exercises that you will see in the program. We do use balls, we do use hand weights, and we do use umbrellas and poles, and you will see the use of those as we carry on. We try to make each class a little bit different and update some of the exercises or offer modifications if you need modifications. So I do believe in letting you read by yourself. So here's a little bit about me. And I'd like to mention that I also connect with the Osteoporosis Canada Foundation. Canada is really very active in the research. This is another view. The first table you saw was where we pick up our food. And then we come into this room, which is set up very nicely with tablecloths and flowers. And this is where we mingle and we socialize. And everybody brings in a recipe that is laden with bone healthy food for osteoporosis. And they stand up and they describe their recipe and they just explain, why they chose it. And to this date, even though I've been doing them for 20 years, we have never had a duplicate. Maybe we'll have different salads, but never two the same. And we take those recipes and issue them out a few days after the cafe. Now, osteoporosis means holes in a bone. And there's two levels. One is osteopenia. But first of all, I just wanted to show you a normal bone on the left. The normal bone does have holes in it because if we were born with sheets of bone, we wouldn't be able to stand up. It would be like working with a suit of armor. So the normal bone has different holes that make it very doable for movement. Now, the slide on the right shows you the absence of some of those connecting walls, creating huge holes, which make the bone very unstable and readily available for fracture. The diagnosis for osteoporosis is done in a machine called the DEXA, DEXA. And although uh, many aspects of these studies are represented on your bone report that you get, the only one that we pay attention to for guidelines is the T-score. And everybody would have a T-score on their report. And this is a global recognition of establishing a comparable system for looking at bone density across the world. So when people have a bone density scan, I would really like to have a copy of it as I go over it with each one of you individually, because everybody has a different situation in their bones. And I would do that either over the phone, and when I'm back at the office, I would do it in person. But I do want to go over all of your scans. Now, there's something called the trabecular bone. This is a scan that can be done with a regular DEXA scan. Now, the DEXA scan gives you the bone density, which is on the outside of the bone. You'll see the green words, compact bone. That's measuring the strength of your outer layer of bone. The inner layer of bone, the microarchitecture, is called trabecular bone. And it just gives you more information or gives the doctor more information about the total strength of the bone. It still is in the research stage. It's actually an attachment to a DEXA scan, and most doctors do not have one. And I've only had 3 clients who have had a trabecular bone scan, and the doctor wasn't able to explain what it was. So if you get a TBS report, just let me have it, and I'll deal with you individually on that. Who's at risk? The main thing here is in the box from Merle LaBeouf. She's a world-renowned osteoporosis expert and professor of medicine at Harvard Medical School. And she is somewhat of an authority. And she has had some interaction with me. She really appreciates my program, and she sees her patients who come to OsteoFitness doing extremely well. So she texted me this one day. Increased cortisol is associated with lower bone density. That means if you are hovering over an unresolved situation, which is mildly stressful, that can cause the prevention of building bone. So we do address relaxation techniques in the OsteoFitness program. There are some conditions that are associated with low bone density, and this would be hyper or hypoparathyroidism. These are tiny, tiny glands on either side of your thyroid, the size of a piece of rice. If there's a disturbance there, it will affect your bone growth. Also, hyper or hypothyroidism, type 1 diabetes, and early menopause, rheumatoid arthritis, cancer and its drugs, scoliosis, which is a lateral curvature of the spine, and sarcopenia, which is the dreaded loss of muscle from lack of use. There are also medications that are associated with low bone density, and those big glucocorticoid like steroids, anticonvulsants, and any of the medications for thyroid, SSRI antidepressants. Now, some of the stats on osteoporotic falls and fractures are quite alarming. 50% of people who fall and fracture will need assistance walking, which means a walker or a cane for the rest of their lives. 25% of people who suffer a fracture will end up in a nursing home, and 25% will die. That's the sad, very sad part of this. So there are deaths related to osteoporosis, falls, and fractures. Now, people who walk a lot, they can still have a hip fracture. And people who do not know they have osteoporosis will certainly know it when they do fracture. So it's called the painless silent disease. In that slide, you can see the pelvis and an opening in which fits the neck of the femur. So, Monica, there is the neck of the femur. Now, the femur is the long thigh bone on the left. The fracture is above it, that jagged line with the pink around it. And then you have what looks like a cork or a mushroom. And going into the pelvis is the neck of the femur. So on some of the reports, they just say neck, and that confuses people. So there's your neck of the femur, and it aids in rotation of the femur. The fastest way to prevent a fracture is to prevent a fall. So here we have all of the parts of the body that prevent a fracture and establish balance. Very important to have clear vision. It's very important to have inner ear movement, which we do when we do our neck exercises, because there's a fluid in the inner ear that bathes balance sensors. And if those balance sensors dry up, they no longer can send messages about our imbalance. Joints and muscles, they have sensors in them as well, because 24/7, there's a relay going on between the position of the muscles and joints to the brain. And when everything is okay, nothing happens. But once they sense that there's an improper balance, something from the brain goes to the joints and muscles and has you do that retrieval dance, which is very helpful in preventing a fall. Footwear can cause a fall. Anything that is not encasing your heel, or anything with a heel, or anything that doesn't fit well, or anything that's a small toe box, squishing your wide toe box would really impair your stability. And home safety, I think, is well known about not having cords or loose rugs or poor lighting or a lot of clutter around. Those are definitely areas where a fall could occur. Dehydration is very, very dangerous because it does dry out some of our brain cells and it dries out our muscles. And we definitely have to have hydration as part of our program. Five for Focus is something I've designed because it can save a fall and it does work for many, many people over the decades that I've been teaching this. When you're going into a terrain, whether it's new or old, especially if there's poor lighting, you want to look at the ground and see what is there as an obstacle. There may be something you'd have to step over. There may be something you'd have to avoid by walking to the right or walking to the left. You haven't started walking yet. You're putting all this into your brain to have it on standby so that when you start to walk, these actions will come naturally. You may have to duck for something if you're outside and you see big branches across your hiking trail. That may be something you'd have to put on your list. Dip down. So the five for focus, or in somebody's house, you may notice Legos on the floor, or somebody has a small dog, or people have houses where there's a step down to different rooms. My neighbor next door has sold her house and she has this grand big house with a step down here and a step down there. And the new people are redoing the whole floor. So the whole house is level because when her father comes with dementia, she doesn't want him to have the possibility of falling down these little stairs. So the five for focus works indoors as well as outdoors. Balance, agility, and coordination are necessities for good balance. Agility means the ability to move quickly, and coordination means to have your muscles and legs and limbs working in a very, very effective way. Proprioception is definitely the awareness of your body in space. If you could walk with your eyes closed and sense what the ground is like, then that would be proprioception. But proprioception indicates where you are, whether you're upright or starting to bend forward. And these are very strong tools that we need, and we do develop proprioception in osteofitness. And there is strengthening. I don't like to use the word exercise because it's kind of glib. Strengthening is the specific type of exercise that we're focusing on today. Now, balance and somehow the word exercise slipped in there. Balance and strengthening improve with practice. We are not given the ability to do Cirque du Soleil right off the bat. Those people practice their balance 6 hours a day. So I want you to know that balance after 2 or 3 days, you will start to notice an improvement. The daily drills are so important that I talk about them every time I present a Zoom class. That's one of the things about this program is it needs consistency where you're strengthening and exercising and doing our program 2 or 3 times a week. And it also means that we have to increase the challenge constantly. Now, here we have dizziness, which some people notice when they go down to the floor or when they bend over. So, blood pressure medication can cause dizziness. Low blood pressure can cause dizziness, dehydration, excessive use of alcohol and or narcotics. Anxiety is a big one. Anxiety can cause dizziness and cause us to fall because it's taking us away from our focus. So we do talk about focus in this class. And any kind of a cold or sinus infection and the medications to treat the above can cause dizziness. Now, here's an exaggerated position. I don't think we're going to do that in class. Um, you could try that on your own, Monica, if you wanted to. Uh,
Think so.
okay. I wouldn't be surprised if Iona would be trying it. Iona's here with you. The awareness of your position and movement in the body, and it's not done with eyes, you see. We think eyes are everything. They're not. If you have a dark room or you've got eye problems or your glasses are broken, you cannot rely on your eyes. You need another backup system. And this is internal. It's called proprioception, and it tells us when our body is in danger. And we do need it for tasks such as walking and driving and typing, especially driving when you're trying to pull in to do some parking, um, parallel parking. You know that you need some awareness of where your car is and where the other cars are. Now, proprioception declines with age, and that's why we have to bring it up with drills. And we do have a lot of drills in our class that deals with proprioception development. This is this got a lot of press a few years ago, and it's starting to get more and more press. And there's two departments of benefits. One is physical and one is cognitive. So we're going to start with the backwards. It is such a wonderful tool. We do it as often as we can in class. It reduces the impact of steps. So that means if you're dealing with a sore hip, knee, or ankle, you're not putting the same impact on that limb as you would be in forward walking. So your body has to switch around quickly, and in doing so, it stimulates the neurons. It puts them on red alert that this is new. Is this dangerous? We don't know what it is. So they work harder. So it develops really a good, strong network of neurons. It also is used to improve balance and coordination. A lot of the professional athletes now are doing backwards walking as our ballerinas. And because you're starting off with the contraction of different muscles, you're strengthening different muscles. And that's always a good thing, including back muscles and also the stability of your spine. Stability is achieved by having strong muscles around the skeleton. It's also good for arthritis because sometimes people with arthritis of the knees or hip, they have pain when they're walking. When they walk backwards, they don't have the pain. It's also excellent for plantar fasciitis, post-stroke, and knee problems. So, what's recommended by the professionals on backwards walking is 30 minutes a day. But that's very hard to do. So, I like to be realistic with these things and at least do 5 minutes at a time. And then maybe you could do 7 minutes at a time. But just make sure you're walking in a safe place with nothing on the floor. And as I said, it increases your flexibility, strengthens joints. And after you've done some backwards walking, you will immediately notice that your forward walking is much easier and much better. You will see a quality change in your forward gait. And like I said before, they're using it in athletic training and occupational therapy. And some people like the idea that it burns more calories. Now, the cognitive benefits of walking backwards, it definitely improves your cognitive function, as I said, because we're stimulating more neurons, which would include better memory, faster learning, reflex time, which is a sort of like a reflex reaction time to some kind of a danger. Problem solving skills, that would be wonderful to just get them out of the way and not have them bothering us into an anxiety state. But walking backwards can help that. And then the fluency, which having a smoothness with your movement is always a good feeling. And there we have it, scientifically engaging more neural pathways and muscles than normal. And it's forcing the brain to adapt and improve coordination. And of course, it's a really plus for proprioception and reduces endorphins, which make you feel happy and boosts your mood. So you might want to warn people in your family that this is a therapy that you're doing, okay? If they see you walking backwards. But I want you to try it because it's so amazing that after, say, 5 minutes of it, you feel so much better. Now, for those of you who like a little science here, the remodeling process of bone includes resorption and formation. So the top circle slide is a bone with the cell called osteoclast. And the osteoclast's job is to clean away dead bone cells. Isn't that lovely? It's like it's taking out the trash. The second circle on the bottom is showing what looks like pimento olives are the osteoblasts, and their job is to build bone. So when we're young and before the age of 30, we're busy with our osteoblasts building bone. When we reach the age of 30, which is supposed to be the ideal state of bone, then we start seeing more usage of the osteoclasts. And that's why we have to start strengthening, because strengthening improves the osteoblast performance. We want more cells built than we want taken away. What that force is called is stress. And that's what we want is more bone cells. The bone remodeling cells called osteoclasts, those are the ones that take it away. With strengthening, they become less active and they signal to the body, produce less of these osteoclasts. So I think if you're interested in more of that, we could talk about it on our own. The thing is, though, not every type of exercise builds bone. That's why I hate to use the word exercise glibly. How do you like that word, glibly? Is it a word, Monica?
I don't know. I've heard of glibly.
Well, you know what glib is, so
Yeah.
you
I
have to
don't
really.
know. Maybe it's a new one.
Well, we try to, speak accurately here, and I think glibly fits what I want to say. I want to have, you understanding. Glibly is like with very little effort. Okay. Now here's the exercise that builds bone, and in osteofitness we use hand weights. So the strength training is increasing muscular force and endurance. There are two types of strength training. One is the weight training, which uses the force of your own body against gravity, and that would be a squat. We do those in class. Then we do the resistance training, which is the use of props, such as hand weights and leg cuffs. We do not use elastic bands, although we may be coming into that down the line. The only way that strengthening works is if every month or so, this weight, the resistance increases. And of course, I said consistency has to be twice or three times a week. The other thing is the training needs to be specifically targeted to the osteoporotic sites. which are the spine, the lumbar spine, the hip, the neck of the femur, and the wrists. So those are the areas that we cover. That doesn't mean other bones don't have osteoporosis. It means they don't have enough to what they call be a significant amount. So they have chosen the most popular hangouts for osteoporosis. And every exercise that we do is targeted to an osteoporotic site. Now, how do you know you've done enough strengthening? A lot of people love the idea when they've been strengthening with a certain weight and maybe 2 or 3 pounds. Wow, this is getting so easy. Oh, this program is so easy. I love this. When at the beginning, they may have had to feel a little fatigue. So when they get to the point where, oh, this is so easy, that's the point they need to move on. Because if you don't have the muscle working extremely, you're not getting enough force on the bone. Now, the force goes from the muscle to the tendon's attached to the bone, and the force is transmitted to the bone. And at that point, if you're feeling extremely fatigued, the bone starts to bend. There actually is flexibility in a bone. And of course, the body, being very neurotic, says, oh no, it's going to fracture. The bone is bending, it's going to fracture. So the brain says, calm down. We're going to deal with it right now, and we're going to put some calcium into that spot right now. So that's how having your calcium readily available works. And that's how bone is built. But if you don't get to extreme fatigue, that means the force to the bone is not strong enough to build bone. So you have to go to either get a very, mean instructor that says, oh, you have to go up in weights or you need to do more reps, like myself. You're not going to build bones. So please pay attention to me because when I try to increase people's resistance, I do it with love and care. I know people don't like to struggle, people don't like to sweat, but that's one of the aspects of the success of this strengthening program. And we do not go for pain. I want you to stop when you feel pain, all right? And let me know about it in an email. And typically, we do 20 to 24 repetitions on each site. Now, what happens is the first few are warm-ups. Say in 20 reps, the last three are the ones that would be extreme fatigue. Then you're using the amount of weight that's appropriate. If you get to 20 or 24 reps and it still feels like a breeze, that's when you need to go up in your resistance. And I can tell by watching people in the class when they're not really working. I can tell that, Monica.
No, you found that in me yesterday.
Oh, lovely fascia. Everybody knows about plantar fasciitis. It's so popular. Everybody's got it. But you don't have to have it. And we're not going to get it if you belong to osteofitness. Look at it. It's just like a loose gauze membrane over everything. It holds bundles of muscles together and it holds whole muscles together. It takes over your organs so that when you stand up, your intestines don't fall down into your pelvis. If you stood up, your appendix and your stomach and your pancreas would all fall down into the pelvis. But we do have fascia supporting those organs so they stay somewhat upright during the day. But fascia is connected to the muscle. It has to be on the muscle. It's sort of like saran wrap, and it can become twisted if the muscle is misused and twisting at the wrong angle. The fascia twists, and then it gets clumped and stuck like saran wrap and causes pain. Now, movement will help fascia from clumping. Hydration will stop the clumping of fascia. And I know that in a lot of literature, they talk about jumping. I do not encourage jumping in the osteofitness class for several reasons. Movement, squats, lunges, resistance training, all of that is very helpful to fascia. And like I said, hydration helps prevent fascia from becoming tight and painful, but so does heat. So that's why the exercises that we do or movement can help loosen fascia. But when fascia is not addressed, it turns into scar tissue. And you see a lot of fascia and scar tissue after an injury or surgery. And there's a method for removing fascia and breaking it down, and I'm trained in it. And when I'm doing my muscular therapy, I always check for fascia because it does restrict the joints and the movement. Now, we did talk about the targeted sites, the hip, the neck of the femur, which is where the femur connects into the pelvis. I showed you that. Total spine, lumbar spine, which is the curve around your waist, and I had mentioned the wrist. So we do exercises and strengthening, which the exercise would include the warm up and the stretch that we do for each of those sites. So we cover all the bases. Now, here we go to some exercises that is not recommended for anyone with osteoporosis. Sitting up doing the crunch, sitting up doing sit-ups. And for that reason, the Pilates program doesn't offer a lot because there's so much of this flexion in Pilates that you'd have to have modifications and you'd have to maybe risk injury if you decide to sneak in a few crunches. There's one exercise in Pilates called the 100s, and that is a really, a quick arm movement while you're sitting in this crunch position. So ask me if you have questions about some other exercise that you want to do. Twisting of the spine with force can cause a fracture, like the golf swing, the end of the golf swing, and backhand in tennis. And there's quite a few exercises in yoga causing twisting of the spine with force. So here they are, forward bends, shoulder stands, some of the deep hip stretches, the deep twists, and some of the warrior poses and pigeon. And I've just summarized Pilates by saying spinal flexion. So there are indications for strengthening and there's contraindications. Speak with me if you have a question about yoga or Pilates. Now, here's a very popular exercise, swimming. Swimming is considered the perfect exercise because it uses every single muscle in the body. However, if you're going to be doing very exaggerated rotating of the spine in a freestyle, that would be contraindicated. And walking, everybody loves to walk, and it has so many benefits. Everybody should do it, although they're getting away from the 10,000 steps per day. Walking does not build bone. Uh, so, since so many of my people love to walk, I can't say do your walking and then leave it and then come back and do strengthening exercises. I try to make good use of your time, you busy ladies, and I'm adding lunges to a walk that can make your walk what we call osteogenic. So I don't know if we've done one with you yet, Monica. I know Iona, you know all about it. But when you're doing a walk, take a few steps into a front lunge and maybe do 3 or 4 lunges as you walk and then keep on walking. So we try to break up a regular walk with forward lunges, and that way you're not wasting your time and re disregarding bone building. But don't forget, there's just so many good benefits to walking, especially in the fresh air. I'm talking about walking outside, I think, not treadmills. So we have something called decompression of the spine. Most of the reports from spinal x-rays are related to compression of the spine, like stenosis and spondylothiasis. These are, scary, scary diagnoses. But the predominance of them is caused by this a spine from the vertebrae sitting on each other and sort of landing into each other, putting some pressure on the disc and any nerve roots that come out of the vertebra. So on the left, we have a lady bending forward at the hips, and she's going to lift herself up gradually, one vertebra at a time, over the ball so that she's in an upright position. And then she'll repeat it. She'll unfurl her body down to a flat back, hip hinge, and then unfurl herself up consciously stretching every vertebra away from its neighbor as she comes north onto the ball. Now, this is another example of flat back. This is a very hard exercise. The one on the left is showing a beautiful hip hinge. She is not bending in her vertebra. That's important. And we stress that. I stress that. You, they, and everybody else knows that in my class, you cannot bend at the vertebra and not get away with it. You will have some spinal problems if you're bending in the vertebral realm. So she's hip hinging very nicely. And then she brings her arm to the front for a position called pointer dog. And she's now engaging her glutes, her upper hamstrings, strengthening her whole spine, including the lumbar spine. She's not strengthening her neck of the femur, though. So we don't get, all five areas of osteoporosis straightened out in one exercise. Now you can see the pole behind her. That's a walking stick. This is another added challenge to the pointer dog, is to hold the ball out. That adds a challenge, so you want to keep lifting your leg a little bit higher while you hold the ball out front. This is a position that we call beach ball. So the knees are softly bent and we're dipping at the hip. She's very good at getting the flat back. And then we lift up and the elbows stay bent at the top. There's no straight arm lifting with a weight. This beach ball is imaginary. And at the end, you're rolling your arms around a beach ball to hold it. So that encourages you to never straighten out your arms. We also take care of the cervical neck, which is the neck that you're used to, not the neck of the femur. We stand by pulling our palms forward. We pull our shoulder blades together and we create a much better posture. At that point, we can tilt our head to the right or the left. I will guide you. But she is combining this with a calf stretch with her foot on the hand weight. So as we progress, Monica, we'll start multitasking and we'll get different things done at the same time. Now this is a back row. Notice again, she's got a dip at the hip. We are doing the back row by lifting the elbow up, and then by straightening the lower arm out back, we're adding strengthening to the tricep. This is rather a difficult exercise. And lately, because of the heat, I have been breaking it down into two positions, the straight elbow lift and then down, and then some separate exercise for triceps. But as we get cooler, we will get, more progression. This is a very good exercise for the lumbar spine. This is called the plank. The first one is a central plank. The second slide on the right is a side plank. And she definitely has a good position here and a good strength here. If you wanted to drop your lower leg in the side plank, that would still be good. And it's nice to notice that she's smiling. How many people smile in a plank? Thank you, Cookie. Thank you. Here's the good part, nutrition for bone health. This is a tough one to teach, and this is why we have sent out, I think this week, just a special excerpt on nutrition for osteoporosis. So print that thing out and put it on your fridge. But this is an overview of what the bones need. And I think in a couple of blogs earlier, I sent out something specifically for muscle health and protein for muscles. So we've got a lot to take care of in this body of ours. You all know that's a piece of salmon. Okay, salmon has calcium and fish oil, very healthy. And we have a lovely avocado, which has magnesium. So here we have um, on the right, we have Magnesium. Magnesium is very, very important, not only for muscle function, but for helping metabolize calcium in the bone. And 340 milligrams per day by food is best, but a magnesium supplement is also safe should you want extra for maybe some cramping, because magnesium's role is to release muscles after they've been contracted with calcium. There's some nice sources for magnesium: whole grains, leafy greens, nuts and seeds, which you can mix. You can put your nuts and seeds into a salad. You can put avocado in a salad. Spinach has left the realm of calcium and is now listed as a hefty source of magnesium. And if you wanted to know why, that would, email me. The raisins, who knew about raisins and tomatoes? So over on the left, we have vitamin K. There's about 7 or 8 breakdowns of vitamin K. The ones I'll deal with will be K1 and K2. And what we need per day is about 100 to 300 micrograms per day. And it's best if it's obtained from dietary sources. It's very important because K2 is the best one and it helps the most with calcium metabolism. There used to be K1, but the more research they do, they keep pulling things out of the charts. It used to be K1, the leafy greens and avocado and sprouts, protein, K1 from plant sources, but I think that they've switched it now to K2. And K2 is animal protein. And I think I've checked with you, Iona and Monica, that you've taken animal protein. One serving of animal protein will give you what you want per day. And any fermented foods like miso, sauerkraut, yogurt, they will also give you the K2 that you need. I mentioned stress earlier with Dr. LaBeouf and her warning that cortisol levels, if there's maintained at low levels, will prevent and inhibit bone growth. And there it's all listed. So I think I've mentioned all this, and I'll just end up with the last statement. It is critical to reduce stress, not only for bone growth, but for other organs in your body. Right off the bat, there are some ways to reduce stress. Now, this would be any kind of exercise. It doesn't have to be strengthening, although that works. But exercise helps reduce stress, as does meditation and yoga. The Benson breath I teach in class. It's an inhalation to 5, 3, and out to 5. I teach head tapping and body tapping in class. Contracting and relaxing muscles. I do that sometimes in class. Being in nature, I don't do in class. Being in nature would be you getting out of the house and being near trees, grass, and anything flowering and blooming. And herbal teas, they all have relaxation effects. Finding your natural circadian rhythm means going to bed and sleeping 7 to 9 hours and waking up without an alarm clock. The alarm clock is the worst thing that you could have in your bedroom. It puts you right into the fight and flight response, which is a startle. And the way to, if you're using an alarm clock now, try to go to bed 15 minutes earlier the night before and just see if you could start waking up closer to a natural awakening. You may have to take several nights of going to bed earlier by 15 minutes, but it certainly would be worth it. Once people wake up to an alarm and then they quite often go to coffee, you're definitely setting yourself up into a stress mode. For a lot of people, music is relaxing and laughter is very relaxing. And this is vital, socializing. Socializing is being stressed now so that people can ease some of their anxiety and have some laughter. Helping others is a good way to reduce stress. And there's that practice you've read about, I'm sure, called listing your gratitudes. and doing a list and remembering them daily with some breathing can definitely pull down stress. This is a little more on sleep. What happens when you sleep is you're repairing your tissues. The muscles and the bones do their business during your sleep, and your immune system is strengthened. You will have a little better memory and learning ability if you're well rested. And like I said, the CDC recommends 7 to 9 hours of sleep per night. So here is somebody sleeping. Less than 6 hours is not good. If you have a long-term sleep deprivation, you are going to increase your cortisol and you'll weaken your immune system. And the changes in bone metabolism uh, really depend on having a good restful night. And they say that 9 hours is too much. So it's really something to work on. You can't do it overnight. And trying to have a consistent sleep schedule with a routine, like we put our children to bed with pajamas and teeth and a story and wherever else. There was quite a routine for some children. Sometimes it would take 2 hours to get them to bed. But as an adult, you can create your own system, whether it's doing some facial cleansing or doing some deep breathing, putting your phones out of the room and darkening your room and cooling your room to about 68 degrees is recommended to improve your sleep. And then we've said all that. So I wanted to say that yes, we have studies that osteoporosis can be reversed with strengthening nutrition and stress management. Sometimes the addition of medication is necessary for osteoporosis, but mostly osteopenia can be reversed with strengthening nutrition and stress management. There's a picture of our Calcium Cafe. People are lined up and the recipes are on the table. This is a graph I showed. This is what happens when I receive your DEXA scans. I put them on a graph, and this graph is showing 2 out of 3, all 3 areas improved in the gray box is when they started with osteofitness. And the lady on the right is the lady who modeled for you, and the lady on the left is a member of OsteoFitness for many years, and they definitely stated that their ability to be active with their life, with their job, with their family, can be attributed to their attendance and longevity in osteofitness. Classes are Tuesdays and Thursdays at 11 a.m. Via Zoom and 4 p.m. via Zoom. And also in Concord, we have the 12:30 class in that studio with all the skeletons in it available. You know that, Monica, right? You've done all of them.
Yes.
Uh, we can choose a Zoom time. You can choose a Zoom time. It doesn't matter. You sign up. It doesn't matter which one you attend as long as you attend. And of course, there's a recorded video available if you cannot attend a Zoom. And we have the email there in my website for registration. I also run a program in Lexington with the help of Carrie Powers. She is an excellent exercise instructor, and I've been working with her and training her for nigh on 10 years. So I trust her with the Lexington class. That meets Wednesdays and Fridays in the studio at 10 a.m. while the Zoom is being recorded. So you can take the Lexington class in the studio or via Zoom. So Carrie covers both of those modalities in one class. And there's the information for registering. Oh, there's that other one I love. Walking is not enough. You need strengthening and flexibility. I hate to say that to people, but I'll repeat myself. That is why I introduced the front lunge into your walking, so you can make walking a strengthening exercise. Okay. So this is how you may contact me. The website is for your information, and my physical address is there in Concord. I want to thank Cookie for being such a great model